Legislative Latino Caucus, we have worked on a number of different bills, whether it's making sure that our disabled community was able to have access in multiple different ways, whether it's through the telehealth process, whether it was, there were a number of bills that, as you know, that I introduced, Javier. I'm taken back because the recording stops and goes, so I'm not sure.
I'm sorry, we're having so many technical difficulties. We're supposed to record
it's
each
okay.
one of our
I just
workshops.
don't. It's okay. I just don't know if I need to stop. If I need to,
just you keep doing whatever you're doing. No, that's just all our issues. I apologize.
No, that's okay. But it's because of the awareness that's created by so many of you, right? In terms of working closely together and making sure that the civil rights of individuals with disability is never ignored. That it's front and in front of us, and making sure that we do that. The laws that offer those resources and services are absolutely vital, as you all know. There are the recent pandemic highlighted the need for an urgency to establish, as you know, the Advisory Council on Life-Sustaining Measures and the Commission on People with Disability. And that was done as a result of some of the highlights of the pandemic. We sponsored a couple of bills that we took into account. And let me just say, one of those on the state level, we tackled the bill that included requiring an induction loop listening system installation in certain public buildings to assist people with disabilities with hearing loss when they're entering those spaces. Another policy that was that's already signed and it's signed into law was requiring an ombudsman to establish a long-term care advocacy and educational training program within those facilities. Another one was making sure that we did everything that was geared towards preventing, to prevent social isolation in group homes. And another was making sure, and I spoke about it at the very beginning, was to ensure that health insurance providers cover the cost of telehealth and telemedicine, to make sure that that allowed the use of accessible communication features for individuals with disability, especially when they are speaking to their doctors and specialists. And there were two other things that I wanted to make sure that I highlight before I conclude my comments. We want, for the members of the community that want to work, we wanted to make sure to create a resume bank and to revise requirements for the New Jersey Workability Program, and to make it easier for people with disability to enter the workforce and be productive citizen. Among one of the other policy, I'm happy to be working on a bill identifying a person with autism or communicative disability through a notation on their motor vehicle driver's license or non-driver's license ID. Beth was very instrumental in sharing those important thoughts with me, but I'm glad to say that that was a bill that we worked on very closely, and finally we're in that. And the goal was really to make it easier for a person with disability to be able to more easily communicate with law enforcement officers, so that when they encounter that, hopefully that limits the chances that an ordinary interaction prevents an ordinary interaction to escalate to a more, I don't want to say for lack of a better word, a violent confrontation, right? So those were some of the bills. I think it's important that we protect our members, our residents, making sure that we can do everything that we can for within our means to be able to provide that. So as you can see, we have been tackling a number of issues from various different angles, and as legislators and community leaders, you know, the saying goes, right? We all know that it takes a village, right? But between your advocacy on these very important issues and on all of our leadership on these initiatives, I believe we will continue to make progress possible, just by making sure that we work on both, you know, within both areas, within both spaces, and coming together as one. So that would be thank you, Javier, for giving me the opportunity to kind of share with you what I'm doing on the state level. And certainly, let me just say, on a national level, we are absolutely bringing all of those matters to the attention of our national, you know, group, so that we can propose some of those very same resolutions.
Thank you. And thank you, obviously, for all the work that you and the Latino Caucus do in this space, because I know that when, you know, our other group, the New Jersey Disability Action Committee, was reaching out to different lawmakers, that the Latino Caucus, you know, were the first members to sign on to some of these bills and to really push for them. So, you know, thank you all for, you know, ensuring that, you know, these programs exist, and eventually, hopefully, some of these bills also go through. So I want to jump to Beth, since we talked about the autism bill that that you guys are working on, and the importance of making sure that people with disabilities, you know, obviously not just individuals with intellectual and developmental disabilities, but also people who are deaf, people who have cerebral palsy, many people who normally, because of their movements or because their inability to hear or whatever reason, have been either hurt or in some cases killed by police officers who believe that they weren't paying attention to their directions. So the importance of bills like this just cannot be understated, especially in communities of color, where we know that, you know, those are the communities most affected and most likely to have a negative police interaction. So, you know, if you couple that with also having a disability and being a person of color, obviously those two statistics may not end well for our community and the people that are being interacted with. So Beth, if you want to tell us more about your work, and you know, just follow up with on some of the stuff that Senator Pou said. And you know, I know you've done a lot of work because of your son, but I know you are also a mover and shaker. So I know disability is present in everything you do.
Absolutely. And first and foremost, let me just say thank you to Senator Nellie Pou, who, when we knocked on her door, and also her chief of staff, Carol Cuadrados, who also have done a lot of work on keeping this bill going. So thank you, Senator Nellie Pou. You have been such a great supporter, and I really want to just to make note of that, of this community. And I'll be knocking on your door potentially, you know, in the future, just because I know that you have that door open for us and for all the families who have a loved one with a disability. I also want to say Peggy Arnasto was instrumental too. She's one of the ladies, and you know, she's a mentor of mine that went that day to see Senator Nellie Pou to advocate for this bill. And let me just say this: a lot of people, Javier, think that you have to have power, you have to have money, you have to be an elected officials to make a difference, and you don't. You actually, it's better off if you're not, because what we've been able to do is work, you know, across the aisle with both Senator Nellie Pou, who is a Democrat, and also Senator Corrado, just to have them both sponsor a bill. And, you know, Corrado is the Republican, and we did the same, you know, through the assembly as well. And that's the key. The key is that, you know, disability is it goes across all races, all culture, and that's it. It should be in the forefront whenever we make decisions in our community. This bill, believe it or not, I wouldn't say it was my idea. I happened to have a coworker that knew someone else, a mom that had worked in Connecticut to pass a similar bill. Theirs is a bit different. Theirs is with a blue envelope that the person has to have all the time with them in the car. And the way that she did is there was this woman running from assembly and knocking on people's door. And she said, I'll support you and I'll help you win if you help me pass this bill. And that woman ended up winning. And that's how it all happened. For me, it was more just going to, the elected officials that I just mentioned, Senator Nellie Pou. And I'm happy to say that this bill was approved 39-0. I want to point that out because what I have noticed in my journey as an advocate is that no matter what political party you are, whenever you bring these situations to the forefront, people unanimously approve them. They are like, oh, I didn't think of it. And that's the key. Because you're not living with it, you are not paying attention to what's missing for those that need it. A good example of what I'm saying is I went to our mayor in Wayne and I say, listen, none of the parks that we have, they're beautiful, but I cannot take my son there, and nobody can with, especially a child with autism, because they take off. They will get killed on the road because there is not a fence. And by the way, all the benches are really positioned in the back of the park. So we really can monitor the entrance to the park if they take off. So that resulted on them also building, unbeknownst to me, I just wanted them to retrofit a park, and they actually built a park from the ground up. It was also approved by every single member of council, and it's all Republican, but one Democrat. And it was a $765,000 park. I'm going to put all the links in there so you could see the state of the art. They actually just got an award, the director of Parks and Recs, because of the way it's a state of the art and all the equipment that they use. The other thing that I want to just mention real quick, Javier, if you allow me, you asked a question, what do you see the major challenges, during COVID, right? And that is the same, but now it's worsened, unemployment on individuals with disabilities and especially individuals with autism. But in general, this community was really behind. The numbers as astronomical. I mean, this, Javier, that the unemployment for this community has always been the highest. And with the COVID, it made it worse for us. For this community. So what are we doing about that? And in Passaic County, we're blessed to have leadership such as Senator Nellie Pou that cares. And we have rounded up our advocacy and ability committee, and we have started virtual meetings to provide resources and information about where to go to get help, to get employment, a variety transition programs. So we're hosting our next, it's called the Disability Resource Employment and Autism Awareness Month, the DREAM Conference on April 7th. I'll put the event right, and that's next week. Believe me, the agenda is packed with information, all the way for high school students with, individuals from the districts coming to speak about the transition program, all the way through the resources and living independent. So please share that information. I'm going to put it on the chat. So Javier, there's so much more we can do, and one of the things that I heard the prior president speak to you about, hey, Javier always make sure that Rokers, there was a ramp, there was, access. Well, you know what? This winter, I noticed that the ramps that are in the street were covered with snow. So I put something on, on the township Facebook page and website, hey, make sure people clean that. And again, The point is that people are not intentionally doing or missing things. It's just that you need to point it out because they're not thinking about it. Thank you, Javier.
Well, thank you. And thank you for, all the work you do, and definitely make sure you put the links in there, because I know my wife works in the school system, so she could definitely send it out to all her school district. And I know Denise is with Protection Advocacy. She could send it out to her groups as well. So Millie, one of my favorite people in New Jersey, because Millie is not just an advocate and a Latina for sure, but also one of these people that she's gonna get her point across, and she's gonna get her advocacy across. And, she fights hard, one of the biggest fighters in terms of people in New Jersey, especially during COVID. And, I knew Millie for a long time, but I didn't really know Millie until she joined our New Jersey Disability Action Committee in terms of, her commitment to like the issues. She really worked hard in, putting that report that we sent out to Senator Pou and all the other lawmakers and the governor, which was a report to some extent really critical of, the systems in New Jersey and the way we were working, and to some extent continue to work. But she does it from the point of view, just like myself, of someone who lives this every single day. So Millie, if maybe you want to talk about some of the COVID things you've seen, some of the challenges, maybe some of the stuff that you might be doing in the field.
Absolutely. Thank you, Javier. This is Millie. So I think I'm going to backtrack for 1 second and just say, to make sure that we're all on the same page, that disability is defined in the Americans with Disabilities Act as a physical or mental impairment that substantially limits one or more major life activity. That can include breathing, seeing, hearing, thinking, communicating, mobility, learning, and capacity for independent living. So when we're talking about disability, we are talking about an estimate of 1 in 4 people in New Jersey, in the United States, in the country, who live with a type of disability. So that is the population that we're speaking of. It's not just a few folks that we're talking about. So I just wanted to start there with kind of the basics. I posted in the chat the Disability Action Committee. It's kind of a landing page just for information about Javier, and a report that the group created following the beginning of COVID-19, or throughout the beginning of COVID-19, about all of the things that were happening throughout the state where people with disabilities were falling through the cracks. More tragically and more infuriating was the fact that people with disabilities were dying in the state at disproportionate levels as compared to our non-disabled counterparts throughout the state. So when we talk about what was happening and what continues to happen in COVID-19, because of COVID-19, it is people with disabilities are dying, period. And there's so many reasons for that, but just a few. Nursing homes, right now the Woodland Behavioral and Nursing Center is, being looked at, investigated for, neglect and abuse within their facility. That's not unique to that facility, unfortunately. People with disabilities, and again, we talk about elderly people who are nursing homes. Elderly people, whether or not they identify are people with disabilities, if they weren't, they wouldn't need round-the-clock care in nursing homes. So those folks were dying in nursing homes because the COVID was not being contained in nursing homes. We had no access to vaccines in the beginning. If there was access to vaccines, 2 things were happening. If you were homebound, if you could not leave your home, how did you get a vaccine? If you did leave your home to get a vaccine, how did you get to the vaccine sites? When you got to the vaccine sites, are they accessible still? Are they accessible? How do you still get to vaccine sites right now? Making vaccine appointments, the access to websites. Websites were not accessible to people with disabilities. Phone calls were hour-long wait times. There was, when people were going into the hospital, there were 2 major issues. The first was that there are known cases in New Jersey and across the country, across the world probably, that people with disabilities were put on do not resuscitate calls, actions, because because they were disabled, because their lives were seen as less valuable as other people who were also in hospitals suffering from COVID. And then those with intellectual and developmental disabilities in particular were not allowed to have visitors. So they had no support care. People who were deaf had no support care. How do we as people with disabilities communicate our needs within the hospital system if we do not have the people who are trained and who know us and are able to support us? Those were absolutely some of the things that were going on. For me personally, I, before the pandemic, was already on medical leave for a chronic health condition, and I was not able to get to my doctor's offices to get stitches taken out. My stitches grew into my skin. I was not able to, in the beginning, to get telehealth. So many things happened, and I'm still not, fully healed from all of the things that happened because of COVID and because of the lack of access that people with disabilities were getting. I will say on the flip side, Beth, you mentioned unemployment, but I will say that one of the things that did happen that I think I hope we continue to pay attention to is things like virtual or hybrid access to everything, to art, to work, to community events, to, you name it, cultural events, and what that did for people with disabilities, and how people with disabilities that sort of got on a more level playing ground because we had virtual spaces in which we could exist, and where access to a particular location did not matter as much. So anyway, there's so many more, but those really are kind of the major things. And I just repeat again, just so many of us died. So many of us died in this, in the last couple of 2 years, and it just shows how unprepared the state, the country, and the world are to handle these major crises, and particularly to honor the rights and lives of people with disabilities in these crisis situations.
Thank you, Millie. And again, Millie is on point in terms of what happened and what to some extent continues to happen. And we think that this, when you ask your average person, well, why did this happen? Everyone's going to say because of COVID, right? They're going to say this happened because of COVID, and that's why these veterans have died. That's why these people with disabilities died. That's why the elderly died. And the reality is that it didn't happen because of COVID. It happened because of systemic failures, of long-term historical issues around race, poverty, disability, ableism, that really just, when COVID hit, it was just like, hey, you've been doing all this for so long, and we're just going to expose this by showing you what happens when we continue to basically deny people of color, deny people with disabilities, the elderly, the most vulnerable in our society, the opportunities to thrive. And Millie's just said it, right? This might be new to some of you, but for the longest time, if you were a person with a disability working, and God forbid you ask to work from home because you say that, hey, I can do the same job at home. I don't have to come in. I don't have to be on Access Link like I was the other day for 2 straight hours when I'm just going to be going to Rutgers, which is 20 minutes away, right? And they would say, no, that's not fair. Just because you have a disability doesn't mean that, you should get special treatment. Well, guess what COVID did? Everybody got special treatment. And all of a sudden employers are like, well, why do we always have these office space? Why are we paying all this money, to keep the lights on and all this when people can just work from home? So, when Millie's talking about this stuff, she's basically saying, we told you so, it's easy to do it, so hopefully that tells employers, getting back to Beth's point and Millie's point, that tells employers, hey, we're not only here, but we do an excellent job. And it doesn't matter if we're in our home office or wherever we are, we're going to do a good job and you're still going to make money.
This is Millie. I just want to add that personally, I had literally 2 weeks before COVID, the beginning of COVID, had requested with doctor's notes, etc., to work from home, and was told it was against company policy. And within 2 weeks, the entire organization was working from home like that.
Wow.
But yet it was against company policy. I mean, that alone has been just having experienced it in such close proximity to the beginning of COVID. I really have no words for the fact that how quickly accommodations could be made when those who are not typically asking for accommodations need them. It's startling.
But I say, Javier, also, I wanted to comment on the bright note, because I always like to bring the positive. I think what COVID did was to force us to go virtual. That allows individuals with disability to be able to participate more in activities, conferences that otherwise they wouldn't be able to be at because of issues with transportation. If you're blind, trying to get to the city, so I feel like this virtual, resource fair, I love it because I know that now anyone can join. So I think that it's a positive thing that we're now have that flexibility to assist this community that really needed to probably just do it from home. So yeah.
Absolutely. I think we all agree. And in terms of, for another question, in terms of some of the advocacy around some of these issues that we've mentioned, I know for me in particular, transportation is a huge issue, especially given the fact that many of us can't even find an assistant. Even if we have a vehicle, like I have a van that someone could drive, usually my wife drives me or picks me up from work, but I have to take Access Link into work because I have been trying for the last, year to find an assistant. I've increased the pay and you just can't find people because, nobody wants to work for a job that only pays so much when they could go to Amazon or FedEx and make $5 an hour more, and not have the responsibility that someone would have with someone with a disability. So for me, some personal top challenges obviously are transportation that I would like to see more done with, but also personal care assistance. And I would really, and I'll ask you all to name some of your challenges, and I guess I'll ask Senator Pou to maybe think of some of the bills that she might be looking at or might have that might be important for this community. And then the other thing that I know that we're pushing, and Emily's pushing with us, and is the funding for the Office of Emergency Management. So we saw, as an example, all these people who died because we were not prepared. Yet today at the Office of Emergency Management, I think they have, I know they have, let's just say a half a person because it's part-time to manage the whole state of New Jersey as it relates to emergency preparedness for people with disabilities and Latinos and other communities that do not speak English. So, and I know Senator Pou knows this bill because we introduced it last year, or they introduced it last year. And we would like to see this bill passed, but realistically, we don't even think it's something that should be legislated. We think it's something that the governor's office should just fund. It's $1 million. And what that will do is it'll give that office, is it 3 positions, Millie, or 4?
I believe it's 4.
So it'll give that office 4 positions to work with people with disabilities all the time. But it'll also allow that office to work with non-English speaking communities, which is our community, right? Many in our community do not speak English. And in cases of emergency, how do you communicate with them? You don't, because they don't speak English. And for the most part, the state of New Jersey has not done a great job at making sure that things are available in multiple languages. So, those are some challenges I see. I don't know if you want to go next, Millie, and then we'll have Beth and give Senator Pou a chance to listen and maybe think about some of the stuff that we're talking about.
Sure, thank you. This is Nellie Javier. So you want me to talk about some of the, some of the legislation that's been
Well, I would just say some of your personal challenges that you see, like what from your perspective, because I know you deal in other communities and work with other groups.
Absolutely. I think that So you mentioned transportation. I mean, I think that is certainly top of the list, particularly here in New Jersey, our paratransit system, which is a system that is supposed to be an accessible system for people with disabilities to be able to get around in the state. And it's truly not sustainable. So many people think people with disabilities are lazy, they don't want to work, they're home, they don't do things. Well, the truth is, like, when my car's in the shop and I take Access Link, I am up at 4 a.m. to grab a 5 a.m. Access Link when I don't have to be at work till 9 a.m. But that's the hours that I'm able to get transportation. And I'm at work till 5, I get picked up at 6, I'm not home till 8. That is one day for a full-time job. At the end of 5 days, I've worked and been on the road for 60 plus hours, 80 plus hours actually.
Yep.
It's completely unsustainable, completely. That is why many of us are not going out and doing things and going into the community. And yes, virtual spaces created more access for us, but we wouldn't need virtual spaces to be accessible for us if physical spaces were accessible for us. You know, it's like we are 30 plus years post ADA, post Americans with Disabilities Act. We are still having conversations about how to make places accessible. Why are we having conversations about it? Why have more actions not been made to that point? You know, Beth, you also mentioned earlier, you know, the fact that you see curb cuts in your town and there's snow on them and you posted it on the Facebook page. You know what we need? We need allies, because being disabled and having to advocate for yourself literally every day from the moment you wake up to the moment you go to sleep, and sometimes in between, is completely exhausting, and we cannot do it alone. We cannot do it alone. So I think one of the, you know, things that I would like to see is just more allies, more coalition building. You know, we're here with the Latino Action Network. I am both disabled and Latina. Like, we are two things. We are multiple things. We have many identities, and we need to be working with one another to make sure that our needs are being covered across the board. So I think that needs to happen. And then, you know, I think people with disabilities struggle largely in education, in employment, and in healthcare and in housing. If I had to pick, you know, in addition to transportation, if I had to pick kind of the top 5 where we are really struggling to get access, equitable access, any access to those things, I would say those are the spaces where we're having the most difficulty. Yeah, I mean, each one of those could probably be several minute conversation, but generally speaking, I think those are the areas. I would say right now, like, housing in New Jersey, finding accessible housing, the lists for housing are very, very long. The wait times are very, very long. And I have a friend who's going through the housing situation currently, and, you know, their name came up for housing. They went to go see the space and it's not accessible. Their bathroom is not accessible, yet it was supposed to be an accessible unit. You know, so again, you know, we're being told sometimes that things are accessible and they're just downright not. And this happens in every space. It happens in hospitals. It happens in doctors' offices. Let me talk about doctors' offices for 1 second, because we're talking about COVID. Doctors' offices, not accessible. How many? I cannot tell you, you know, and for those of you who are not disabled in the room, have you ever had to, you know, sit in a chair to get examined instead of laying on a table? Have you ever just skipped a test because you couldn't get, you know, access to the machine, like a mammogram, for example, because you couldn't get access to the machine? I suspect that's not been your experience. That has certainly been my experience. And that, in fact, my primary care physician, I kid you not, I've been with my primary care physician for 10 years, mention every single time that I'm in his office that I need to get on the examination table. In 10 years, my primary care physician has never seen I have chronic wounds, has never seen my chronic wounds, has never done a full physical examination because I cannot get on the examination table. 10 years. You know, so the issues are very real. They run very deeply, and they are, as we saw in COVID, very life-threatening. One of the spaces that I work largely in is in emergency management response recovery for people with disabilities. I am board president for an organization called the Partnership for Inclusive Disaster Strategies. And so that's another area where I think, as Javier was mentioning with this legislation that we're talking about for the New Jersey Office of Emergency Management, where people with disabilities, our rights and our lives really need to be centered in those conversations and those policies and practices as well. So
thank you, Melanie. Beth.
Well, listen, I think Millie, I literally want to take you with me because every point that you made was spot on. If you look at the agenda of the fair that I mentioned we're hosting next week, after the keynote speaker, and I kid you not, I could share my screen right now, Javier, is literally employment travel for persons with disability. Mm. The reason why this is critical is because our committee noticed that we could get the employee, the job, but to get to it, that's a whole different story. And so like Javier was saying, and it's one of the #1 challenges that we have in the United States, and I will even say the world at this point, since I'm from another country, I could tell you that right now. So I feel that we definitely need to put a little bit more energy to speak about, you know, accessibility to transportation for individuals to be able to become productive members of society. And let me just tell you, individuals with disability, I'll speak for based on what I see on my son. You know, they're like your best, most loyal, happy, you know, passionate employees in the whole world. I cannot begin to tell you, my son for the longest was not getting paid on this job because we got it through a friend of ours in the supermarket. And he's like, Mom, I don't want to tell them that I haven't gotten paid because I don't want him to think that I'm doing this job because I want to get paid. I'm like, well, that is why you're doing the job. And he don't want to say anything. So, you know, the other thing is, you know, housing, and that is critical. I remember we went to this elected official opening house, and I remember, Javier, you remember Sal? That was, yeah,
vaguely, yeah.
He went nuts because there was not accessibility made available to this office. And these are, again, nobody is intentionally doing anything. It's just that people don't think about it. And that, so as a mom, that is my job. You know, something as simple as you're going into kindergarten and the first program that children are, you know, exposed to is Safety Town. Well, we discovered that most of our kids could not attend Safety Town because it was not accessible. It was not a structure in a way that they could even participate. So we did partner with the district and the mayor to make it more accessible, that program, you know, little things. You know, I was driving to Essex County from Passaic County because I didn't have a Special Olympic, you know, available for my son. I went to one of the elected officials. This was Pat Laporte at the swearing ceremony. I said, listen, do you know I have to drive like almost an hour and a half to get? He's like, oh, why don't we make, you know, give you access to the Passaic County Tech Pool? We should not stop raising, bringing awareness. That is our job. And I'm not going to stop there. I'm going to continue. So Millie, I love to connect with you and see how I could volunteer to your committee or how it could be of service. I literally utilize politics not to gain anything for me. And most of these program guys, my son does it. And then he's like, I don't want to do it anymore. So it's not for my son. You know, I really, it's a passion of mine, and I use politics and I leverage that and my connections to assist this population. It's what I was born to do. So, you know, let's continue to collaborate, work, and bring awareness.
Thank you, Beth. So just as a heads up, we have about 6 minutes. I'm going to give a few minutes to the senator, and then we're going to try to just take a few quick questions. I apologize. They actually extended the time. And again, as you all know, these things usually take, like Beth is smart. She's doing it in a whole day, but conversations like this do take a long time, and I encourage you all to connect with each other. If you want to put your information in the chat and, have it available for other people, I think that would be great. So, Senator.
Thank you, Javier, and thank you once again to Millie and Beth for all of the information that you've shared thus far. It is so very true that folks such as myself and others that have a responsibility, a position that we might be able to assist and do something about. We learn about all of these things every single day. And Beth, you're right. It's well intended. It's not for any lack of desire not to do that. It's just because, you're in a situation to be able to continue. Both you, Millie, and Javier, and many others in this space are in a position to be able to provide us with your input, your stories, educate us, help us to understand the importance of that. Millie, as you were speaking, and Javier talking about the transportation and the paratransit or the access link mode of a transportation that's available to the disabled community. I remember in my early years having worked for the city of Patterson for over some 40 years or so prior to, or even during my legislative responsibility. But, the paratransit program back when it first started was a big deal, because, it was the first time when it was launched, and it was really providing access. What I noticed throughout much later into that process, there was a lack of desire for initiative, for more creative thinking, for lack of the same type of funding. That there was some funding reductions throughout, and that was again before I was a legislator. So the transportation, as you all have talked about, is one that certainly hits home for many of us, whether we live with someone with a disability, or whether we are folks like myself listening and working closely with the advocates and all of you. It's something that we need to continue to bring about. The English, the limited English speaking ability makes it even more difficult, because we find ourselves I find that that information is less and less available, and that information reaches out to our community less so than some of the other larger population. That's a critical area that we really need to continue to speak out very loudly and continue to talk about. When I say that, I'm talking about how everything that we, as to the best of our ability, everything that we do, we try to do it where they have to translate that information in more than one language. Legislation today, you very seldom will you find when something is being done, that if it requires reaching out to a population at large, we want to make sure that it is also available in more than just one language, and Spanish being, because of the large population, Spanish being one of those primary languages. The coalition building opportunities are one that absolutely needs to continue. And I think that some of the legislation that we have introduced recently allows for that type of gathering, or group of professionals and information collection, such as what we're talking about here. To do that, we need to do more of it, but I do think that we are moving in that direction. And again, it may not have been stuff that we thought about, like Beth talked about. It could very well be because because of things that you've brought to our attention that needed to make sure that that gets included. And there are bills right now that we are both sponsors, prime sponsors, or co-sponsors that allows for that type of coalition building, information gathering, advocacy direction, establishing, making sure that we are establishing and recommending policies, procedures, regulations, and legislative initiatives, right, in order to ensure that we have an ability to address the disability community. But that was done more so during the public emergency period, when a lot of this, Millie, you've talked about it before, it came to the forefront of so many people. And it was really a matter of making sure that we had the ability to provide information that would help to have life-sustaining measures to ensure that those type of access is provided to everyone. I listened very carefully to what you were talking about when you go to the doctor's office. I never even thought of something like that. I cannot believe that that is information or that is happening today in our world, considering how, you know, we're moving in a more modern society. Well, I learned a great deal today for that. So
Senator,
don't know what you want us to do about that, but tell us and educate us.
So we've got a few